Dr. Pieters is one of the newest additions to the Fraser Eye Care team. He is an amazing ophthalmologist, and he focuses on anterior segment surgery. He brings a wealth of clinical knowledge and surgical expertise to the discussion. Welcome, Dr. Pieters.
Thank you for having me.
Welcome.
So I want to just everyone to get to know you a little bit more. So where did you grow up?
So I grew up outside of Chicago in the western suburbs, a place called Wheaton. That's where I spent my childhood through college, and then I hadn't been back since, but that's when people ask me where I'm from, that's what I say, Chicago.
Cubs or White Sox?
Cubs,
all right,
for sure.
What's your specialty and what's your role at Fraser Eye?
So I am a comprehensive ophthalmologist. So in terms of medical management, kind of everything, I feel a lot like a quarterback. So a lot of add-ons pretty much regardless of what it is, whether it's retinal or neuro-ophthalmology or anything really gets put on the schedule. And then a lot of that I end up taking care of myself, whether it's glaucoma, whether it's retina, whether it's neuro-ophthalmology. But then if it's something that's above my pay grade or we need to nail down a diagnosis or we need different testing or different expertise, I try to make sure that I can get those people to where they need to go. And at Fraser, almost all the time, outside of some rare pediatric retinal exceptions, we can get someone to where they need to go within Fraser. So seeing basically anything that walks through the door, and then for a handful of people figuring out kind of do they need more specialized care. But a lot of it, the medical management is something that I feel comfortable with. And then surgically, it's anterior segment, which is a lot of cataract surgery. So there are a lot of lasers that you'll do for treatments of glaucoma, kind of after cataract care, but surgically the big thing is cataract surgery.
And can you define truly what is anterior segment surgery then?
Essentially anything that is in front of or at the same level of the lens, and different people will do different things. So in my sense, that's a lot of cataract surgery. You can also do some kind of minimally invasive glaucoma procedures, which is called MIGS. And so for patients who have some level of glaucoma and cataracts at the same time, you can do combination surgeries to help with that. Now, there are exceedingly more invasive glaucoma surgeries that would also kind of be in the anterior segment, but I'll leave those to our glaucoma specialists like Dr. Basha. And in theory, some corneal procedures will be anterior segment as well. So if you're doing different types of corneal transplants, that would be anterior segment. But again, we're lucky enough to have 2 corneal specialists in our practice. So for those patients who actually need a physical transplant in the anterior segment in front of that lens, we have specialists for that. But a lot of things in that area. And then there's definitely the random things. So I had a gentleman who had a 5 years ago, I think you might have seen this gentleman, was grinding rocks, and a rock flew into his eye, and it was just there, and for whatever reason his body didn't notice it until 5 years later, and then so we had to open up his eye and get the rock out.
It was embedded in his iris.
And it was in his anterior segment, so that was anterior segment surgery. Now most of anterior segment surgery is just cataract surgery, but that would be an example of that's my little realm of the eye, and so okay, we're going to open it up and take out this rock.
What do you enjoy most about your job?
I think I do best and I'm happiest when I work with people who are motivated to work with me. In ophthalmology, it's almost 9 out of 10 people really are invested in coming in because they very much care about their vision, and you're not fighting people to do things. People very much want to be there, and they want to hear what you have to say. And a lot of the people you can tell, especially in our Port Huron office, these are people who will avoid going to the doctor at all costs for almost anything that isn't their vision. But then when it's their eye, they want to be seen, they want to hear what you have to say, and they listen to you. So I love that, and also just kind of a quirk of cataract surgery specifically. I mean, retina surgery isn't quite like this. Glaucoma surgery isn't quite like this. But with cataract surgery, what we do ends up being effective of the vast majority of the time. So you have people that want to work with you and you feel like you're on a team with them. And thankfully for cataract surgery, it's a really successful and pretty low stress thing. So people get really nice results. So the combination of those two things is what I really like about what I do for work.
So outside of the clinic, outside of the OR, what do you do to recharge your batteries?
So I basically just have old man hobbies. So I bird watch. That takes up a good chunk of my time. in terms of like more normal things, me and my wife really like cooking.
What does a typical weekend look like for you?
Pretty slow. I'm feeling a little older. Like if we go out to dinner on a Friday and I'll have a glass of beer, I feel like I'm ready to go to sleep for the rest of the day. Saturdays, it's usually something outdoors. So either I go to Belle Isle a lot. That would be like a Saturday morning, or we'll go to Eastern Market or something like that. In Ferndale, where I live, there is a small bakery called Secret Bakery. It's only open 2 days a week. It's open on Wednesdays and Saturday mornings. And so I can't go to the Wednesday one. And I probably go 90% of Saturdays to get fresh bread. And I'm probably like in the top tier of their customers at this point. So that's almost every weekend. And then we'll see, like my wife's family lives nearby, so we usually try to see them probably close to every week, if not every other week. And then Sunday is usually a more relaxing day where we're planning for the week ahead or doing errands and things like that. Nothing crazy, but we like to do something outdoors pretty much every weekend.
Do you have any favorite family traditions that you still carry on today?
My brothers and I are like all roughly the exact same height. And so any family photo that we have, we all try to get the tallest in the photo. So we're all like trying to push the other person down and stand up taller. And we started that, I don't know, when we were like 5 or 6, and like we'll still do it. So a lot of photos from my wedding are like us like contorting ourselves, and they don't look very good, but they're very funny. And that's kind of like, it's a very idiosyncratic Pieters family tradition.
Is there a childhood memory that still makes you smile today?
One that my family always brings up over and over again is he was still healthy, but I think my grandfather knew that his heart wasn't doing so great. And so he took the whole side of the family, all went to Italy. I think I was just at I was in middle school or late elementary school where like I was in charge of packing my own clothes. And I packed all like gym shorts and basketball shorts and cargo shorts. And then we went to the Vatican, and you can't get in shorts. And so I had to wear like my female cousin's like capris, which was in retrospect probably looked very European, but they were like skin tight, kind of riding up on me. And so there's like photos of me, and pretty much anytime like anything comes up, if there's like Italy's in the news or the new Pope, like my family will be like, "Oh, do you remember when you were there and you had to wear like those tight capris because you couldn't pack your own outfits?" That's a common one.
Who has been one of the biggest influences in your life?
As I talk to patients, the person that I see myself in is like how my grandfather acted and like how he talks to people, and like kind of one-liners and trying to figure out like what patients you can joke with and what patients you can't joke with. Like that's something that's much more from him.
So you and your wife both being eye doctors.
Mm-hmm.
When your brothers, your friends, parents, in-laws, when they have an eye question, who do they call?
So most of the time, it goes to me because my wife is a pediatric ophthalmologist. Now, my advice is sometimes like a little more gruff, and her advice is a little more maybe calm.
That's why she's in the pediatric.
So sometimes like I'll get like my dad complaining about his glasses, and like my dad would be your nightmare patient. He described his eyes as like, as a child, before I knew anything about eyes, is like some crazy odd anomaly and that nobody could fix his vision. And then when I finally like got into ophthalmology and I learned what he just has one eye that's slightly nearsighted and one eye that's slightly farsighted and a little bit of astigmatism, and he thinks like he's like disabled. And so every single time he gets a new pair of glasses, he is going back and getting it redone, like usually 2 or 3 times for every single thing that he gets every time he gets a new pair of glasses. And so when he calls me, I've gotten to the point where I'm like, this is not a real problem, and like you're creating something out of thin air. But my wife will be like, oh no, like you could try this thing and you could try that thing and you can try this. And so he's now started calling her, but that's because she's still very, very nice to him because she's trying to get in good graces, where I'm trying to give him tough love so he doesn't kind of piss off every single optometrist within a 20-mile radius of where he lives.
But isn't it kind of funny, though? You went through all that training, very smart, you know exactly what you're doing in the OR, pure confidence. You could be doing a home improvement project with your dad in Chicago. At least this goes for me. My parents have a place up north. I'll be using a saw. My dad would be like, be careful. You want me to do it? I'm like, I got it.
Just this summer, my mom had like a big splinter, and it was like on her right hand, and so she couldn't get it, and it was like really deep in there, and so I was like getting it out, and my dad was like telling me like what I should be doing. I'm like, Dad, like I do microsurgery for a living. Like I'm just fine. You could stop telling me how to get this splinter out. I think we'll be good here.
Right.